Hi everybody, I am really sorry. It's been really long since I've actually shot some content, but it's just that I've not had the time to do anything apart from just work because my MPhil degree started and then there's just been that's been happening. There's been time for nothing else. So I wanted to cover a few quick things that you all have had a lot of queries regarding, and I think I want to resolve those queries so that these questions don't pop up again and again in your mind and we're actually able to pass these very quickly and very quickly. I'll be covering those. So the first thing was people had a doubt that does the MPhil, RCI MPhil actually hold valid because the MPhil degrees have been scrapped out. Yes, you are absolutely right. The MPhil degrees have been scrapped out in India, but that does not hold true for the MPhil in clinical psychology. It is the only MPhil degree which is still ongoing because it is a clinical degree and not an academic degree in itself. So all those who keep saying again and again that the degree is not valid, please check your facts because it is very much valid, and that is why we're all doing it. And RCI license gives you a license at the end of this degree. So yes, definitely it is valid. Yes, when it comes to the nomenclature, they might want to change the name of the program since we don't have any other MPhil degree in the country which is running. So they do want to change it, but it still hasn't happened yet. So they were contemplating, whether they want to change the name to maybe Doctor in Clinical Psychology or a postgrad diploma, or we don't know what it is as of now. But as of today, as of now, the nomenclature still states that it is called an MPhil in Clinical Psychology, which is RCI licensed. So that is one thing. The second thing that people have always asked me is how's the structure of the program. So quickly jumping into it, the program is a 2-year program, and you have to pass the MPhil entrance to get into this program after your master's in clinical or applied psychology, preferably because you need to have a background in science, a pure science background for you to actually be able to do this course. And mostly counseling students also apply, but mostly they don't prefer students from backgrounds that are not clinical or applied. And a lot of universities have their own criteria. Like for instance, my university, Ramchandra Medical, like they're very particular that it has to be either a clinical psychology student or a applied psychology student. So either you need to have a master's in one of the two. So if you're from a counseling background, they might not consider you. So yes, if you are looking at being a clinician, if you are looking at getting into doing your MPhil in clinical psychology, I would highly recommend you do a master's in clinical and maybe preferably have a bachelor's in psychology honors as well, or psychology just generally. So coming down to the course, like I said, it's a 2-year course, and the first year you'll be dealing with a lot of assessments, and the second year you'll be doing a lot of psychotherapy. So assessments would include, in the first year would include all your assessments, like your personality assessment, your IQ assessments, your neuro assessments, your assessments in relation to personality assessments, and so on and so forth. And the second year will be psychotherapy, so that will be including a couple of psychotherapies like your CBT, DBT, emotional focus therapy, multiple aspects of therapy. So I cannot I'll go on and on. The list is like impossible to cover. So you will be covering all your psychotherapies in year 2, and year 1 is primarily going to be assessments. So this first year kind of gives us an edge over the other courses because the assessments that we do are very detailed, very clinically oriented, and they are the ones which actually help us provide certification as well. So yes, we cover multiple assessments in year 1, and the second years usually do the psychotherapy. Apart from that, we have the structures paced in such a way that we have 2 internal exams and 1 exam at the end of the year. In both the years, that's how it is. In the first year, you'll be submitting a series of cases based on your assessments, and the second year, you'll be submitting a series of cases based on your therapies. So that's how the structure of the program works, and at the end of the 2 years, you'll be getting your RCI recognized license. So yeah, that's about it. And if you have any doubts pertaining to the program, you can always reach out to me, and I'll always be happy to help. Since that's primarily now I'm actually in the field, I'm actually working as a clinician, so I know how the toiling and all of that works. So I'll probably, as and when I get time, I'll definitely try to answer all these questions and queries that keep coming up. Just coming down to the very basics of how the program has been for me. I'm definitely not going to say that it's a cakewalk. It's also not difficult. It's quite hectic. It's quite comprehensive, and there is a lot of work. But that's very university specific. Like my university is a multidisciplinary university, so we are posted in multiple departments like There's child unit, there's neuro, there's nephro, there's onco, there's psychiatry, there's clinical psychology, of course, our own department. So we're posted in multiple departments, and these postings are on a rotation basis. So everybody gets to kind of, since it's a rotation basis, every single one of y'all will be having a chance to be posted in each of the departments. So that is definitely there. But yeah, it is kind of hectic, like the way people had actually explained it. It's not, everybody has their own experience, because like I mentioned, your university makes a lot of difference. So what kind of a university you go to, what kind of case flows you get there, what are the kind of cases that come in, so that all of that makes a lot of difference. And everybody is not going to have the same MPhil experience, but mostly it's what they say is MPhil is pretty hectic for everybody, because not many holidays, too much workload, and we also don't have too much of a bandwidth, and the patient flow is increasing with the years to come, because psychology as a field is really being recognized by people. So that's definitely it. And yeah, in my own personal experience coming out of that, it has been pretty hectic. It's been a hectic journey. I think it's around 7 months into my course, and I'm really tired all the time, but I do try to make time for myself. So it's something that I always tell people, even on LinkedIn or anybody who asks me on Instagram. Always suggest that try taking out time for yourself, because this course in itself is very, very comprehensive and hectic. So the more time you give yourself, the more time you are able to spend with yourself. That is definitely going to help you, outshine and do really well. So yeah, that is my experience with MPhil. I think I've already covered it in detail in my previous video about how you can study, prepare for this exam and all of that for the MPhil. And if you have any other doubts, you can always reach out to me, and I will be there to help you out. I haven't even had a chance to change after my duty. I just came and I thought I'd shoot this, and I have to get back to duty now. So I'll catch you guys later. Bye.